All right. So my shift is over, but I just want to get on here because I'm telling you, lately, I've been getting out of work like a whole bomb is going off. So I know for a fact God putting the fire to my butt to get up out of this field. Probably doing something else, but bedside is starting to look real grim. So this is what I want to do. I don't know the day or the hour, but I want to pass along any little wisdom I learned in my 13 years of nursing. What I also aim to do is just bridge the gap of communication between patients, patient families, and doctors. See, I gotta run out like a bomb going off. You get reported and you run out. I gotta go to my car. So, and as I said in my previous video, this has been highly recommended by patients' families. I don't give them my info, but I know it's other people out there that's like looking for just an easier, simple breakdown of what's going on. Just a little bit about myself. I have been a nurse for 13 years. Next year, about March or May 14, I've worn different hats. Started out in the beginning as a school nurse. I was in charge of 2 schools, middle school and elementary school. I also, what else? Did a little psych nursing. It's a little small psych hospital. It had pediatric psych in there too. Then I made my way to the acute care setting. First place was Aventura. Telemetry just means heart. Where's my car? I do this all the time. Oh, there you go. Telemetry. Just dealing with the heart and just other diseases. Not necessarily the heart, but it just means you go on the heart monitor. So it's mixed with tele and med surg, medical surgical situations. And that's basically just like usually a starter floor for nurses. It's usually a starter floor for nurses. Then it might go up into they might call it step down or PCU or intermediate floor. That's kind of like the middle. If you're thinking like a video game, like level 1, level 2. And then now I'm in ICU. In between that, I did a little charge nursing and med surg as well. But I'm just telling you all that not to really brag about myself, just to share. I know a little something. I've been through a lot of different experiences that I don't take for granted. I love my patients, but I don't know the day or the hour. But I noticed like some things I do want to talk about that is so dearly needed. I'm going to start from the beginning. I'm not going to jump all the way up to ICU type stuff, but if that's something y'all want to hear about, I'll definitely talk about it, but you got to let me know. But one thing, I'm going to start from the beginning of nursing. Let's just talk about the admission process. Specifically, I just want to talk about sometimes patients that, be like, oh, what did that doctor just say? If I'm out the room giving meds or something, I go in the room and the patient be like, what did that doctor? Who is that doctor? And I'm like, who? What did he look like? I don't know. A lot of them come through. You ever wonder why you got so many doctors? Let me tell you why. So let's say you come in for chest pain, right? Anytime they admit you to the hospital, everybody gets what you call an attending. Now, it could be your regular doctor that you see on the outside, But if they have privileges to the hospital, because some doctors don't have privileges to their hospital, but you're always signed what you call an attending, which is similar to your regular doctor that you see on the outside. Now, you came in for chest pain, you having heart problems, they noticing that you got clot in your lungs after they do x-rays, blood work and everything, and it's also affecting your heart. So you are most likely having a heart attack based on what they see. So let's say you have the diagnosis of heart attack, you have the heart diagnosis of clots in your lungs. They call that PE for short, pulmonary embolisms. So now you got the attending. Hold on, you got to see the light. You got the attending, and then next he'll just consult other people to help with your care. He'll have the cardiologist. He'll also have a pulmonary doctor, pulmonologist, and what am I thinking of? And so with that, they will plan your care. I'm not going to go into details of what's. Everybody's different. And let me give a disclaimer. Please seek the help of your medical professional in regards to your care. I'm not going to tell you how to do and what to live, but I just want to kind of explain a couple of things that maybe it'll make some sense to you now. Some people who've been in and out, they kind of know the lingo, but it's some people who's never been in a hospital, or they have a family member in a hospital that they may have to make decisions for. So I just want to, like I said, my goal is to give a little clarity just to make it more simpler. So now you have these two doctors. Okay, they go in, they may do any type of interventions. The cardiologists may do interventions based on what they see with your heart attack. Or they may put you on certain medications to dissolve the clot. But they go in and intervene if it is a clot. Keep you stable. Pulmonary doctor may follow suit and do the same. But again, you have the attending, but you'll notice because you're dealing with a heart attack and you're dealing with lung clots, they're going to be the main ones that mainly run the show. The attendant still, I won't say over them. He's still in charge of your whole care and coordinating everything, but they're going to kind of run a show a little bit. He's going to let them take lead a bit until things resolve. So now we got your little heart situation settled. They got you on some medications that you'll eventually take home. The medications worked to help with the clots, or they may send you home on medications for that. They've done their part. They do what you call sign off. Once they sign off, you're back in the hands of the attending. Okay, so now you're starting to get on your way to a discharge. They may keep you overnight, another night, just to monitor to see how things going, because it's kind of like doing a pretend round before you send home. We don't just fix stuff and just boom, 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 send you home. They might just want to keep you another night to monitor, depending how serious it is. Cardiologist may sign off, or he may continue to see you to the end of the discharge. Pulmonary may do the same. Your face droops. They think you're having a stroke. You're slurring at the speak. You're slurring your words, not talking right, confused, whatever it may be. They call a stroke alert. Nah, you just came in for chest pain and, clots in your lung, pulmonary embolisms. Now you know, because they finding clots there in your brain. It happens during in the middle of your admission. You was on the road to recovery. Boom, this happens. You get a neurologist, right? So my point is, you get doctors based on what's going on. It doesn't necessarily mean that your attending, which is like the regular doctor, doesn't know anything about the area, but because of the seriousness of the condition, he will consult other people. Now, with some things they may be able to handle on their own, just because you have like maybe an infected cut, he may not necessarily call a surgeon to clean it out. He'll call an infectious disease doctor to kind of coordinate your antibiotics. But depending on severity of the cut, or whatever, how long it's been going on, how prevalent it is, if it's affecting your labs, your vital signs, if the infection is spread, he may call other people, or he may manage it on his own. But it all depends on the doctors and their discretion. So I don't know if I left anything out. Let me know if I did, if there's any other questions in regards to that. But basically, they kind of come on and off based on where you're doing with your condition and your situation. I hope that this answers a lot of questions. But that's one thing. As simple as it sounds, a lot of people would ask me. And I always remember that was like a common question in the beginning. Some tips for anybody in the hospital, or anybody that may be assisting somebody in the hospital, like a family member. Let me think of some questions. I always encourage my patients to ask questions, because nurses, we could only be so many places at one time. And what I am a big advocate for is taking hold of your own care. Or if you're not strong enough to do it, if you have that family member that could be there with you every day and kind of write things down for you and be your advocate. We nurses, we advocate, but it's something about a family member that helps advocate for you as well when you're not at your best, when you're not at your best condition. So I like, the questions I always get is, how long am I going to be here? Surprisingly, it sounds silly. Like, you came here for chest pain, you're like barely breathing, and maybe we get you settled and feeling a little comfortable, but the road to recovery isn't there yet. It's not like you're just going home the next day for something like that. But it's nothing wrong with asking a doc, hey, I'm feeling a little better. When can I go home? What does that look like? Oh, we need to run this test, that test, this. Okay, how long does that take? How long does that results get back? What happens if that doesn't look normal to you? What's the next step? Because what it does, what I feel with patients, the most scariest thing is the unknown. So at least ahead of the game, if you know if it's going left or right, you know what the plan is. So don't be afraid to ask those questions. I tell my patients all the time, I say I'm a bachelor trained nurse, but I still ask dumb questions. I still ask questions like a 5-year-old. And I do that to keep my patients safe. Why are we giving this again, doc? Okay. And you sure you want to give this much? Explain why. And if I'm satisfied with the answer, then fine. If not, oh, I thought I thought my car went dead. If I'm satisfied with the answer, then I move forward. If I'm still not satisfied, I might ask somebody else, like a pharmacist, when it comes to medications, clarify, may go back and forth with a doctor, whatever I need to do. But the biggest advocate is going to be you. They definitely listen to the patients. Sadly, sometimes much more than the nurses. You know, they there to serve you. You got to understand, this team is there, you know, to serve you. And that's what a lot of people forget. A lot of people get a little frightened when the doctor come in, and then they be like, what did he just say? And it's like, what? That's why I always try to, in a perfect world, that's why I try to be in a room with my patients, to kind of ask questions that you might have asked me earlier. I may kind of know the answer, but a lot of the stuff got to come from somebody with a white coat, if you know what I mean. Because nurses aren't allowed to diagnose. So even though we see the blood work and see what possibly may be going on, we are held to a certain level of what we can and cannot say. Because what we may think it is, even seeing from experience over and over and over and over, we don't have a diagnosis yet to take that full picture around. For example, how many of you know what the white blood cells do? And I simply give you the answer. they basically show if there's any type of infection brewing. How many of you know there's certain medications that'll make it go high, like steroids? So you gotta understand there's more than one thing that can make it high that looks at the overall picture. So infection might be, you might not have a fever yet, it might be low grade. Again, go to your doctor. I'm not diagnosing, I'm just telling you from experience that the doctors take the overall picture and they give you your diagnosis. Once they have that diagnosis, then we could talk about it. We could talk about how it's going to move forward with treatment and what we're going to do on our part. What else? What other questions they ask? It's always good to ask what medications they're bringing you, like what is that for, what is this for. There's nothing wrong with asking that. Some don't, they just, and trust me, some don't. Some actually just take whatever you give them, and I always tell patients that's a no-no. I actually, especially if I have a patient twice in a row, I'll explain it to you throughout the day as I'm giving it to you, but the next day if I have you back, I'm giving you vancomycin. What is that for? Oh, that's the thing. That's the medicine that helped with my infection. I'll take that, because now I know you got a clear understanding. I'm not asking you to be no PhD, but I need you to understand what you're getting it for and why. The day before, hi, I'm here with your medication. The doctor has you on antibiotics. This one's called vancomycin. The reason why they're starting you on this one, it covers a broad range of different type of germs. But once we localize what germ it is, they'll taper it down to something less harsh. So we're going to be drawing blood work, ever so often, just to make sure that it's not too toxic to the body, because it's a very strong medication. But tomorrow, I'm going to ask you, I have your vancomycin. You remember what it's for? That's for my blood pressure. No, that's not for my blood pressure. That's for, so, I get gold stars, I get thumbs up, but I reinforce to you to know what you're getting, to know why you're getting it, and know what it's for. Because at the end of the day, you have to be responsible for your care. You have to go home knowing this stuff or what you may or may not be on. There's no way you should be going home and saying, I don't know why they started me on this med. I don't know why I have 2 different blood pressure meds. Why do I need 2? Because one may work differently on the body to get your blood pressure down. So you need to know why. Don't just take the meds home. Don't just take a pill and just accept it like, oh, okay, it's making my blood pressure get better. You need to know why you're on 2, because what you're going to do is go home and say, well, my blood pressure ain't that high, so I don't have to take it. Not realizing it's not that high because the medicine is working and it's still in your system. And you might say, well, I feel better, so I'm going to just take one. No, so much effort was taken to find that combination to get you settled. And of course, some people come off of it. I've seen it done where they work with their doctor and they get on a certain regimen, and some people may never come off of them. But that's all in the works between you and your outside doctor once you go home. It's not up to you to just stop something cold turkey, because you'll cause more problems. I think that's it, but I'll probably make a separate video and just write down some common questions that come off the top of my head. And I'm just trying to revert back to when I was on the floor med-surg telling before I got to ICU of some common questions. And they were good questions, and sometimes I help them out and be like, you should ask the doctor this, and they're like, oh, that's a good question, you should ask the doctor that. And sometimes I get out a pen and paper and we'll go over some questions together, write them down, because I said if I'm not in the room, I want you to be able to have your questions answered. Okay, because when you're on the regular floor, the standard floor, those doctors come around once a day. ICU is great. They're always there. They're always there. That's why I love it. if I got a question, if I need anything, they're like right there. Just tap on the shoulder like, hey, I ain't got to call. I ain't got to wait for no call. I could just ask, you know, the doctors right there what's going on, and hey, come take a look at my patient. They don't look so well. But when you're on the floor and it's just a basic admission, they're around once a day because they have these doctors are pretty loaded. They give them a patient load where they have patients all over the hospital. So you want to be able to utilize your time effectively, efficiently to get what you need. But okay, again, let me know if y'all have any questions. I'm gonna start doing these videos because guess what? I don't know the day of the hour, but I don't think I'm gonna be doing this too much longer.